I'd like to welcome from Harvard Eye Associates, Dr. Diane Kersten. Nice to have you here today.
Thank you very much.
It's always a pleasure to have the doctors from Harvard Eye, and you all rotate, so that's why sometimes I might not see you for about 6 months or so.
That's right.
So it's great that you're here today.
Thanks.
You know, one of the things I wanted to ask you, pardon me, is how often should someone come in for an eye exam? Now, I'm not talking about someone who has eye problems, but just, you know, like you go in to see your regular doctor once a year or your dentist. And how often should someone come in for an eye exam, do you think?
Well, once you're over 60, I think once a year is generally a good idea. If you have nothing wrong with your eyes and your eye doctor says every year and a half, then that's also often fine. It's mostly to watch for macular degeneration and glaucoma and other problems, but definitely a regular checkups.
Okay.
Very, very recommended.
And I know you have told me, as some of the other doctors there, that sometimes you folks will detect high blood pressure before a primary care physician would, just by seeing the effects on the eye, right?
No, it's really true. There's all kinds of medical problems that are diagnosed at the ophthalmologist.
Yeah.
Recently, I had a patient that we diagnosed with a very serious brain tumor, unfortunately, and it started with visual symptoms, retinal detachments, of course. High pressure in the brain is fairly commonly diagnosed at the ophthalmologist.
Wow.
All kinds of problems. So, yes, regular eye checkups are quite important.
All right, I need to come in, have that done. So what's going on with Harvard Eye? And over the past, really year and a half, 2 years, you folks have gotten some state-of-the-art equipment. It's ever-changing, and I know that this area, Orange County, is one of the leading areas in general for eye technology.
It really is. Well, so I'm really here to exactly that, tell you what's new at Harvard Eye, and a few things are just new doctors, and we're expanding. We have 2 new lady doctors joining us, which I'm very excited about. We have 12 providers right now, and we have Dr. Sonia Jute, who's joining us, and she's a board-certified ophthalmologist, a retina specialist. She does medical retina and surgical retina. And she's really excellent with a great bedside manner, and I think
everyone at Harvard Eye is.
Thank you.
No, I mean seriously.
She's especially. Wait till patients meet her. She'll be amazing. She has several years of experience. She's been working in the Inland Empire, so we're very excited. She's starting in October, and then we have a new cornea specialist with us, Dr. Benaz Rahani. And she's not only a board-certified ophthalmologist and cornea specialist, she's also boarded in internal medicine.
Oh, okay.
And I think she'll be wonderful also a great bedside manner. And we have such a need for all of our patients that have dry eyes and irritated eyes. There's an epidemic of, this problem, and I have it myself. So there's hardly, a family.
Is it because of the environment we live in, or?
Well,
what are some of the causes? And obviously there's causes from certain medications one may be taking, or just the fact that you're somebody who likes to work out in the garden a lot, and there's a lot of dust.
Well, I think there's a lot of causes, and it's literally an epidemic, and certainly it's our climate, because it's usually dry here, and that has a lot to do with it. Women tend to get it more than men, especially postmenopausal women. So there's a real belief that hormones have something to do with it.
Okay.
And that probably has to do with all of the increase in rheumatologic diseases, like lupus is so much more common, and a lot of dry eyes have to do with Sjogren's syndrome and rheumatologic causes, and all those things are increasing right now, and no one's exactly sure why that is.
That's very interesting you say that, only because unfortunately my older sister probably, I want to say, I don't know now, 10 years ago, 8 years ago, was diagnosed with Sjogren's. And they were all set to move to Palm Springs from the Bay Area. They bought a house, and that all changed. And sometimes it'll flare up into lupus. I don't know if I'm using the right term.
They're all rheumatoid. A lot of times when
Yeah,
you're
they're all inflammation.
tested for these
right?
things,
Yeah.
it's not exactly clear if it's
Right.
Sjogren's or if it's lupus. But
Right,
mixed connective tissue diseases they're all so much more common today than they were 20 years ago.
Wow.
And dry eyes are often affiliated with those.
That'd be interesting too to find out why. Is it just diagnosed better, or?
I think it's more common, but there's so much research being done on this because the way our immune systems have changed is a big area of interest today in medicine.
Yeah.
So-
That's interesting. I know it's a little off topic, but it's very interesting.
Yeah.
So I mentioned how all the great technology you have over there, and there's all kinds of different apparatus that you use. And are there different ways now that you just, when somebody comes in for an eye exam, are there different ways that you bring them in? Because I know when I came over there, it's probably about 2 years ago, there were different sort of, I want to call them stations I would go to, this one and then that one, and then finally go into the actual eye exam room, and you still have the lenses and all that.
Yes. Well, there's so much great equipment, and there's so many ways we can measure the eye now and take pictures of the macula and magnify it up, 100-fold, and see every cell practically. And it's made it really more fun to practice ophthalmology. There's a lot less wondering what's going on and a lot more being certain about things. And a lot of the technology, it makes cataract surgery more exact. It makes all the things we do more exact. The one thing I did want to mention is that we're always trying to make cataract surgery more precise and more exact, and that's an area all cataract surgeons are interested in. That's primarily what I do. And there's now so much to talk about with cataract surgery because there's new implants. You can have a glaucoma procedure at the same time. If you want one eye distance, one eye near, we can do that. We can make the precision of that much better. And there's so many things to mention to the patients when they're getting prepared for cataract surgery that we are now having pretty much a monthly conference about different areas of medicine. And on the 25th, which is next Tuesday, I'm giving one at 5:30 in our office in Laguna Hills, and it's basically called Modern Cataract Surgery.
And people, is this just for doctors or anyone?
No, it's open to the public.
Oh, that's fantastic, yeah.
It's called Modern Cataract Surgery, all your questions asked.
Oh, good.
So it's a great time for anyone who has questions or just wants to know more about all the things.
So 5:30.
5:30, Laguna Hills office, which is right across from the hospital on Health Center Drive there. We're on the 3rd floor.
And what day again?
Next Tuesday. Well, it's the 25th, so.
Okay, it's
a
Tuesday.
week Tuesday.
Yeah, that's Tuesday.
Yes. And
that's really good. Yeah,
yes,
I like that.
We're really working, all ophthalmologists are making things more accurate and more precise. A lot of people now, they consider cataract surgery a lot like Lasik, and it is.
Yes, yeah, and I was going to ask you something to that effect, if I may. I don't know if this is true or not, but I've heard this, and it came actually, my sister, who is a few years younger than me, about 8, 9 years younger than me, recently had cataract surgery.
That's a common joke.
And years before, she had Lasik, and she was saying there was some complication there, or they had to take more precaution.
Yes.
I forget exactly what you told me. Is that true? Is that?
Yes.
Okay.
In fact, if you've had Lasik, and especially a large amount of Lasik, it's much harder for the cataract surgeon to determine your implant power.
Okay.
And it's very easy to end up farsighted or not exactly, like let's say you had Lasik, one eye distance, one eye near, and you want your cataract surgery done that way. It's a real challenge for the ophthalmologist to get the implant power right so you turn out exactly that way. But we now have a piece of equipment we use during surgery called it's the WaveTech Aura. It's from Orange County, of course, and it's now part of Alcon. And besides having all the pre-op measurements and all the things we do pre-op, during the surgery, once the cataract's removed, there's a camera mounted on the microscope, and we line things up and hit a button, and it takes 40 pictures of the red reflex from the pupil and analyzes that and tells us what implant to put in.
Great.
And it's always more accurate. And there is a cost to the patient, but it's a few $100s.
Oh yeah, I think it'd be well worth it.
People who've had LASIK or people who want one distance, one near. It's so helpful for getting things more exact. So
that's great. Again, the technology is making it better for everyone. It really is. And in
really
some
is.
cases, you know, overall with any technology, the cost begins to go down, and things get better compared to what they were years ago. So that's good to know.
It's made it really fun to be a cataract surgeon, to have all these new pieces of equipment to make things better.
Now, if someone at a certain age maybe wants to look, you know, getting into Lasik, you know, I would love to get rid of my reading glasses here, but maybe 10 years from now I'll have cataract problems. I'm always wondering, should you hold off? Of course, 10 years from now the technology is going to change 100 times, you know. So,
well, a lot of it depends.
How do you see it that?
Yeah, a lot of it depends on how old you are, honestly, because if you're under 40 and you're nearsighted or have a prescription you want to get rid of, then I think, you know, assuming you're a candidate, LASIK's still the best thing.
Okay.
Once you get into reading glasses or bifocal area, and I'm not sure how old you're exactly.
I'm 61,
61,
and you get these really expensive 3 for $15 at, you know.
Yeah, so you're presbyopic, So if you need reading glasses, then LASIK becomes a little more problematic.
Yeah,
I mean, you can have it done for.
I'm getting to the point where it's a little bit blurry out there, but not, you know, not bad.
So in general, if you're in your 50s or older, it might be better to have a lens-based procedure like a cataract surgery early.
Okay.
Yeah, but that's just in general, because we don't have a good way with LASIK yet to give you distance and near, except for monovision. With cataract surgery, we actually have very good implants now that are multifocal implants, and they've also improved so much over the last 10 years.
Well, so much has improved, and it's great you have a couple new doctors with you.
Yes.
We'll get them on sometime soon. Maybe since they're both new, maybe as an introduction, we can get them on both together.
That would be wonderful. Yes, we love.
That way, they don't have to wait every 6 months, like as we rotate through all the folks you have over there.
Thank you so much for having us on, and we really love the
I learn a lot. I think
here.
everyone learns a lot. And again, if you'd like to learn more about cataract surgery, join Dr. Kersten at Harvard Eye. That is 5:30 this coming Tuesday, the 25th. They're right over here across from the hospital, and I could, and the former, whatever you want to call that mall now.
Yes, and you can call the office if you want first to just hold a place. We have food and we have, you know, things to drink, and so it's well, you can just call our main number, 951-2020, and leave a message if you're interested in coming. And
yeah, do so. I think that'll be great.
Great, yes.
Yeah, it's great you folks are doing that.
Yes.
Good to see you again.
Thank you very much. It's
Take
always
care.
a pleasure.
We'll be right back.
Thank you, Ken.